Hi everyone, thank you for joining me today. So today we have the topic of why do some people have. So today's topic is why do we have chronic gut issues and why do some people have chronic gut issues and unresponsive gastrointestinal issues? So this is an important topic, and I think this happens quite frequently, and with many people that have chronic conditions like autoimmune disease or chronic inflammatory conditions, they definitely have ongoing issues with gastrointestinal issues. And we're seeing, kids starting to develop gastrointestinal issues at very young ages now. And really, when you look at the standard American diet, that's really going to promote some chronic gut issues just to start with. One of the things to just start with is that we all have some resiliency in our gut. We have some resiliency for some kind of change. So, for example, we all have a certain microbiome. We all have a certain pH. We have certain types of enzyme functions. We have different physiological processes that allows our gut some degree of resiliency to a pathogen exposure or to a dietary change or to something that impacts the gut. And those things can change over time. Those things can change with different variables. So, the gut is dynamic. The gut is constantly changing. So we know the microbiome, for example, the bacteria in your gut that really dictate your immune response in general, and also your immune reactions to foods and even exposure to different pathogens or bacteria and so forth. They they are really strongly dependent upon the different microbiome species you have, and those microbiome species can fluctuate with your hormones. If your hormone levels change in your lifespan, those microbiome species can change based on your degree of activity in your physical activity. If you have a sedentary lifestyle, the foods you eat, if it's low in fiber, high in fat, your blood sugar control. These are all things that really impact your microbiome, and then you have some degree of resiliency. So, for some people, they can have assuming they don't have celiac disease or have any underlying gastrointestinal diseases, they can have, let's say, greasy bowl of french fries and a beer and processed food for a couple days and really have no serious impact. And then some people cannot do that. If they did that, they would have severe symptoms and severe inflammation and really pay the price. So some people have more resilient guts than others. Usually when we're younger, we have more resilient guts. That's why, like, you see kids and you see what they eat, and you go, wow, they have some pretty good resiliency because they're eating all these maybe inflammatory processed foods, but they don't have any chronic inflammation yet, but that's starting to change as time goes on. So we have some degree of resiliency. It's always dynamic as our life goes on. Now, when you're looking at chronic gastrointestinal issues, some gastrointestinal issues are due to a underlying disease condition that's not curable, which we'll talk about. There's definitely conditions that will cause people to have ongoing gastrointestinal issues for the rest of their life. For example, intestinal autoimmunity. And then there's a bunch of gastrointestinal issues that are responsive to treatment. They're just not being treated properly, so the person has ongoing gastrointestinal issues. So those are like the two main things I really like to cover. Those that gastrointestinal issues that are responsive if they get the right treatment, and then those that are chronic, and then that's a different story. They're just not being diagnosed, and the person doesn't know those things. So let's talk about the ones that can be treated. So one of the most common issues for people that have ongoing gastrointestinal issues would be like as far as symptoms go, of like bloating, distension, feeling like they're not digesting their food very well, feeling inflamed after they eat, feeling swollen after they eat, having inconsistent bowel. Those are all just general gastrointestinal symptoms. So one of the easiest, most common things to cause that is people that just have some food sensitivities. These are not allergies, these are food sensitivities. And when you look at food sensitivities, the most common food sensitivities that people have are really gluten, dairy, egg protein, which is albumin, soy, and corn. So those are the main most common categories. Meaning, as a clinician, when we evaluate chronic patients, we evaluate patients with gastrointestinal issues, and we do laboratory testing, the most consistent ones are gluten, dairy, egg, soy, and corn. Now, there's different theories of why this may have happened. One of the theories is that the addition of pesticides like glyphosates bind to things like corn and soy, and to gluten, changing the protein, making it more immune reactive. There's some information that people have theorized and published on that. And then in general, we also know that wheat, for example, has been hybridized So there's new wheat proteins in wheat that have never been there before. So we have a lot of people that are developing sensitivities to things like gluten, and then gluten has a very similar protein structure to milk proteins or dairy proteins. So most people that are gluten sensitive are also dairy insensitive, and then most grains are very similar in structure to the amino acid sequence of gluten. So many people are also very reactive to grains. So there are many people that have chronic gastrointestinal bloating, distension, brain fog, don't feel well, simply because they have, for example, these common food sensitivities. And, um, you know, gluten sensitivity is very real. And for some people, it can be devastating because they have an underlying autoimmune disease. For other people, it just causes them to just feel a little tired and get a little bloated and so forth. So, as far as responsive types of care and unresponsive types of care, so there's two groups. There's some people that actually have gluten sensitivity that's actually progressed, that is actually celiac disease and autoimmune disease, and then or have an underlying autoimmune disease, some other kind besides celiac disease, and then those that just they're reacting to gluten. And the problem with them is that they have gotten older and they used to remember always being able to eat bread. They used to always have no issues, but now as they get older, they're starting to have these symptoms. So remember, your gastrointestinal resiliency will change over time. And if you combine that with how gluten and grains are changing, for example, with glyphosates or with hybridization, the actual structure of the gluten, what they call proteome, is definitely shown to be more reactive. They call that modern wheat. And many people start to react against it. So many people that are used to eating Wonder Bread when they were a kid, or having cereal, having no problems, are shocked at the fact that they may actually be gluten sensitive. Well, things change. Your microbiome can change over time, and your resiliency can change over time. That combined with new wheat proteins can definitely make you very sensitive to wheat. So there's a lot of people that would benefit being on a gluten-free diet. The problem is most people that when they try to do a gluten-free diet don't do it the correct way. They don't get rid of all sources of gluten. They still get exposure, so they never really know if they really get better. So if you're going gluten-free, you really have to make sure you're not getting exposure from condiments, ketchup, sauces. You're not getting exposure from eating food that's been fried in the same oil as breaded foods at a restaurant. You really have to go 100% gluten-free, and you need to do a little bit of research to make sure you understand all the different concepts there. So those are the key things that you should know about gluten. Now, a lot of people are gluten-free, and studies have shown even with celiac disease people, they don't feel significantly better because they're still getting exposure to milk, and milk is very sensitive to gluten. So gluten and dairy-free diets seem to be work the best. That's why many people that go gluten-free really go gluten dairy-free. So like in the autism community and childhood developmental disorders community, the diet isn't just gluten-free, it's gluten and dairy-free because they're so similar. And then many people react to grains, so they go grain-free. This is why paleo exposure is just get markers to measure gluten sensitivity and see if that's there. It's not allergy, it's not celiac disease, but a lot of people have chronic inflammation there. Now, another reason why people have ongoing gastrointestinal issues that is overlooked is they have intestinal permeability. They have leaky gut, so that's when the tight junctions open up. This is something, it's pretty popular. Most people know about intestinal permeability. And you can get intestinal permeability from chronic stress. You can get it from having a gastrointestinal infection. You can get it from being on antibiotics for an extensive period of time. You could have it from being on corticosteroids for a period of time. You can get it after a combination of some heavy dental work where they use antibiotics. You're in a stress response, and then your gut's never the same after, let's say, a dental procedure. So you can have intestinal permeability show up at different times in your lifespan. And when it shows up, those tight junctions open up, and then undigested food proteins cross, and then those undigested food proteins tend to cause inflammation. And the most common food proteins that cause inflammation are going to be gluten, dairy, soy, egg, as we said, that tend to cause it. So sometimes people really need to just go on a leaky gut diet and just really support recovering and letting their gut heal as they go on a strict diet to avoid grains and dairy. as they're supporting their gut regeneration with things like glutamine and different natural botanicals that have anti-yeast, antibacterial properties. At the same time, they're taking enzymes. At the same time, they're taking prebiotics, probiotics to really just change their gut microenvironment. We recently launched a course called Gut Health Solving the Puzzle at Dr. K News. If you need help to have someone teach you how to guide you through it with recipes and instructional videos and teach you the concepts of things like how to support and manage your leaky gut, please go to Dr. K News, drknews.com, and check out our Gut Health Solving the Puzzle program. And you can get information on how to help you go through that process if you need help. In that program, we also teach you how to differentially diagnose where you may have some gastrointestinal issues that are involved. So that's a resource if you need it. Now, another reason why some people have chronic gastrointestinal issues that can respond to care is hypothyroidism. So one of the most common symptoms of hypothyroidism is really chronic constipation. And thyroid hormones are critical for a few things. Thyroid hormones are critical for activating the metabolic rate to allow smooth muscles of the gut to contract, to allow your gallbladder to contract, to allow your intestinal cells to contract so you can move food. When a person's actually in a hypothyroid state, when their laboratory TSH levels are very high, and they just don't have enough thyroid hormones for their gut, they will get constipated, and since they don't move food, they get bloated, they get distended, they can get small intestinal bacterial overgrowths, they can have leaky gut. So sometimes these patients have no thyroid symptoms and they just have a chronic gastrointestinal issue. So if you're a patient that has chronic gastrointestinal issues and nothing makes sense, and you've tried to do all these different things with their diet and nothing's really worked, make sure you get a blood test. Make sure you get screened for hypothyroidism. The key thing is to actually know if you're in a hypothyroid state is just to have something called thyroid stimulating hormone, or TSH, measured. And if your TSH measurements are high, that means your thyroid's not working. And the most common cause of that is an autoimmune process called Hashimoto's. But typically, if you're in a hypothyroid state, as soon as you go on replacement, your gut finally has a chance to respond and recover and work. You'll have other issues to deal with because you have an autoimmune issue. If you have Hashimoto's, causes a hypothyroid issue. But just be aware that just actually being in a hypothyroid state is a factor. Now, there's also a lot of Hashimoto's people or hypothyroid people that don't get their thyroid hormones checked regularly. So, the standard approach is someone gets diagnosed hypothyroid, they go in once a year to have their thyroid hormone measurement evaluated. And, the thought process behind that is, since most hypothyroid conditions is Hashimoto's, they expect the thyroid gland to destroy more of the thyroid gland. And as a year comes around, a person may need to increase their dosage to compensate for that thyroid gland destruction from the autoimmune process that occurs in 98% of hypothyroid people. The problem is some people get into hypothyroid states 3 months after the last prescription or 6 months after the last prescription. So their point may be a year ahead, and they have this gap of 4 to 6 months where they're actually in a hypothyroid state and their gut does not function well. So if you have hypothyroidism and you have chronic gut issues, make sure you're getting your thyroid hormone levels checked regularly, because if you're in a low thyroid state, your gut's going to have a really hard time responding. And just having your microbiome flourish, having your tight junctions regenerate and heal, and then having proper intestinal motility. So that's another major cause for people that have chronic gastrointestinal issues, is that they have an underlying hypothyroid issue. Especially if they don't have any thyroid symptoms, it can easily be overlooked. Now, there are also some people that have chronic infections, and this may be more common than you think. As a healthcare professional running gastrointestinal profiles on patients for many, many years, you can see even people that don't have a lot of gastrointestinal symptoms, when they get a comprehensive stool analysis done and they do a parasite pathology assessment, many people have pathogenic meaning shouldn't be there, parasites, or they have significant bacterial overgrowth, or they have pathogenic bacteria in their gut. So there are people sometimes that just have infections and their gut environment is not healthy enough to get rid of them. So that is really hard to tell unless you actually do some type of digestive stool testing or analysis where they actually look for parasites. Now, not all labs are equal. You really want to make sure your lab is a specialized lab that does comprehensive testing. I personally like to use Genova Laboratories I think they do a great job with their stool analysis. But that's another common reason why some people have chronic gut issues. So when you take a lot of people that don't have uncurable, but actually have conditions where their gut can actually heal, the most common ones, just as a recap, is a sensitivity to food protein, gluten, dairy, soy, egg being the most common. Having a leaky gut that's turned on at some point and then the person hasn't really allowed it to heal, and they have to go into a strict diet for a few weeks to allow it to heal. That's another major cause. And then there are some people that have these subtle intestinal infections that take place and they just don't know about them and they just never get their gut healthy. So those are the three most common. Now, if we add a fourth one to that, and this is very common, especially in women over age 40, is a lot of women have unhealthy guts and can never get their gut restored because they have a very subtle gallbladder problem. They have biliary stasis, they have thick bile. When they eat fats, they don't digest it well. They start changing their diet where they don't have any fats in their diet because they get bloated and distended. And it's very important for your gut to release bile, not only digest your fats, but bile actually activates receptors in the gut called FXR receptors that help your microbiome function, that help your immune system function. So sometimes there's like an underlying gallbladder issue that causes people to have ongoing gastrointestinal issues. Now, they don't have gallstones, and they may not have gallstone obstruction, so it gets totally overlooked in the healthcare system. But they have what's called gallbladder sludge, or they may have gallstones when they do an ultrasound. They just haven't obstructed them, but their efficiency putting out bile is now compromised. So that's another common reason. So everything, again, so as a recap, people that just have subtle sensitivities, gluten, dairy, soy, egg, corn being the most common. People that have leaky guts that just haven't allowed their system a chance to heal and recover from that, so they have this ongoing intestinal permeability that just persists and persists and persists until they finally treat it. Some people have subtle infections that just get missed in the healthcare system because, currently in the healthcare system, if you're not coming back from a third world country with severe diarrhea, they don't consider the fact that you may actually have a pathogenic parasite or some type of pathogenic bacterial issues in the gut. And then the fourth most common one would be just gallbladder issues that are subtle, that tend to really just throw off the gut microbiome. So those are really common ones for people to have some gut imbalances. And the other key things I would just add to that is it's really critical for the gut to have fiber. Some people just don't eat enough fiber. You may have to actually put an effort to eat fiber in your diet and really have a diverse amount of fiber in your diet to really make sure your microbiome is healthy. You may want to focus on adding some fermented foods like pickled vegetables or kimchi or sauerkraut into your diet to really make sure you have those fermented food sources to really help with the microbiome. So those are a big deal. And then for some people, it's just really a combination of multiple things that all start to add up that really make their gut unhealthy. They don't eat much fiber, then they end up eating a lot of processed meats that are very high in antibiotics. That'll change your microbiome. They become sedentary. That'll change your microbiome. And then maybe they have a underlying chronic stress response, don't get enough sleep. That'll change your microbiome. Now they lose their microbiome resiliency, and it isn't like one main diagnosis or main disease. It's just that they're unhealthy. And as they focus on improving their health, improving their diet, maybe exercising, moving, doing some things, does their microbiome start to change and they get healthy. So there are also some people that have chronic gut issues because it isn't really to one main thing like an infection or leaky gut. They just have so many various lifestyle factors that are throwing off their integrity of their microbiome. Again, most common ones being sedentary lifestyle, because movement actually improves your microbiome. Not enough fiber, not a diverse amount of fibers in their diet. A lot of processed foods, foods really high in animal product antibiotics that are used, or even taking antibiotics. Combination of those things can really just make a person's gut microbiome unhealthy, and they become less resilient. So those are all conditions that if you changed and did some strategies to support your gallbladder or fix your leaky gut, improve your microbiome, improve your diet, they can change. If you need more help with that, again, check out Dr. K News Gut Health Puzzle Program. We can walk you through those steps. Now there are other conditions that are permanent, that are ongoing, and they do exist. There are absolutely conditions that are not curable, not reversible, in healthcare. So one of them is celiac disease. There are some people that have full-blown celiac disease. Now, hi. My wonderful wife, Dr. Reyes, is helping me.
Hi.
Hey, with some questions. I just need another 5 minutes, and then we'll take some questions.
Okay, I gotta get the sweater because it's freezing in here.
Okay. So I have my AC on because my office is right next to where the sun hits, and the rest of the house doesn't. And then she comes in my office, and she's freezing all the time. So.
Well, it's cold in here.
Okay, so let's talk about conditions that are not responsive. So let's talk about celiac disease. So some people have celiac disease turn on at different parts of their lifespan. So you could have celiac disease turn on like as a newborn, as a young child, and then you have gluten issues your whole life, and then you may have developmental delays, and it may take years to get diagnosed, and you have chronic illnesses because of that. Or you could have had no indications or no patterns of celiac disease in your entire childhood, and then when you're 30 or 40, those genes then express, and now you have celiac disease turned on. Now celiac disease is devastating your health. And it's turning on autoimmune diseases, it's causing severe inflammation, severe bloating, and you may not even know it. Maybe starting to promote neurodegeneration. So the key thing to understand about celiac disease, that it's a autoimmune disease, and all autoimmune diseases, as we know, are basically classified as uncurable diseases. They have the chance to go into remission with, let's say, a healthy diet, lifestyle, but they're not going to go away. And they're always going to be a challenge for someone once they turn on. So some people have celiac disease turn on, and they may not even know it until they're later. And for a lot of people that have celiac disease turn on, they don't even necessarily have a lot of significant gastrointestinal symptoms. They have mild gastrointestinal symptoms, but they really have significant, for example, brain symptoms where they have severe depression or severe brain inflammation, early signs of neurodegeneration, things of that nature. So that's one thing. So it's always important to get screened for celiac disease if you have chronic gastrointestinal issues. Now, there's also another group of people that have not celiac disease, but have other types of autoimmune diseases of the gastrointestinal tract. The most common being Crohn's disease or ulcerative colitis. In early stages of Crohn's disease and ulcerative colitis, the symptoms may not be very clear. Typically, people don't get diagnosed with Crohn's or ulcerative colitis. They have severe gastrointestinal symptoms. They have gastrointestinal bleeding. They have severe bowel urgency, and there's just something obviously wrong with their gut. And they go see a gastroenterologist. They do an endoscopy, and they finally start to figure out the diagnosis. In early stages of Crohn's and ulcerative colitis, which can last 5, 10, 15 years before they have severe expressions of the disease, they may just have chronic gastrointestinal issues. In those cases, you can screen them very quickly with blood tests. You can do what's called the ASCA or ANCA antibody test, ASCA or ANCA antibody test, and you can screen to see if there's any intestinal autoimmunity there. So there's a group of people that have chronic gut issues, and they really have this autoimmune disease that's turned on, and it's not causing their chronic gut issues. And they're really frustrated because they actually start to eat really well and they start following all the right guidelines, but despite doing all of that, they may have ongoing gut issues. Now, as a clinician, the biggest clue to me that someone may have intestinal autoimmune disease, a patient that comes in and their diet is really healthy, and they're eating lots of healthy foods and vegetables and diverse diet, and they're not eating anything processed or off sugar. They're eating lots of probiotic promoting foods, fermented food, lots of great things. They're taking probiotics, taking supplements, taking all this digestive support. And despite doing all those things, they still have chronic gastrointestinal issues. And those people are very frustrated. And a lot of times you do blood work and you find out, okay, well, they have Crohn's disease or ulcerative colitis, and that's why they're constantly dealing with gut issues despite doing everything right. So that's something that is really important. Now, another reason for chronic unresponsive gut issues, besides autoimmune disease of the gut, and when we use the word unresponsive, referring to people that are doing everything right, but they still have gastrointestinal issues. Another main reason is early nervous system destruction or early neurodegenerative diseases. And the most common neurodegenerative disease that really impacts the gut that we know about is early Parkinson's disease. And Parkinson's disease doesn't start in the brain. It's been shown to really start in the gut. And there's a buildup of proteins called Lewy alpha-synuclein, and which develop what are called Lewy bodies, and then these different proteins get in the way of normal synapses, and they start to degenerate the gastrointestinal tract. So there are some people that have early neurodegenerative diseases really causing chronic gut issues, because what's happening is their nervous system in their gut, which is involved with contracting muscles of the gastrointestinal tract, allowing the autonomic nervous system to function, to get blood flow to the gut, allowing the autonomic nervous system to release digestive enzymes and cause the gallbladder to contract. All the things the gut needs to have happen from a neurological point of view are not working well because those nerves are degenerating. So those patients typically come in with chronic constipation. They have to have stool softeners or do things like coffee enemas or take laxatives to have normal bowel movements. And then if you really start to dig into their history, they start to have early signs of neurodegeneration. With Parkinson's disease, they start to get micrograph. Yes, when they write like a sentence over and over again, their font size gets smaller. That's because they're getting rigidity and they're getting spasm. They may even have writing cramps. They may get stiffness in their muscles. It usually starts with one limb, like a frozen shoulder or frozen hip. They notice their movements are much slower. Family members notice the movements are slower. They may start to lose their arm swing when they walk. That'll happen years and years before they develop any kind of tremor, which most people think are associated with Parkinson's disease. So another major cause for chronic, ongoing, and unresponsive gastrointestinal issues, besides intestinal autoimmunity, like Crohn's and ulcerative colitis and celiac disease, is really some early types of neurodegeneration. There's also people that have chronic unresponsive gut issues, not because of Parkinson's disease, but they have a chronic inflammatory issue in their gut. Like, let's say they have chronic inflammatory bowel disorder. They just have always had a bad gut because they've never really treated it, and that's been going on for 10, 20 years. And that chronic inflammation actually starts to degenerate the gut itself, the nerve plexus of the gut, and it's unrelated to something like Parkinson's. So chronic inflammatory bowel conditions that aren't really addressed, people just go, I can get a little bloating, I'll just keep eating my food, it's not too bad, and they kind of get to that lifestyle and do that all the time. Over 10, 20 years, you can actually degenerate your nerve plexus of your gut, just like your brain can degenerate. Your gut nervous system, called the enteric nervous system, can degenerate, and there's some permanent degeneration, loss of gut function at that point. And that's a whole different pattern of chronic unresponsive gut issues. So, in summary, as we take on questions here, I talked a lot, I'm sorry. There's one group of people that have chronic gut issues that have a chance to turn it around, and there's a group of people that have a series of gut issues that are going to always deal with it. Now, we should point out, for the people that have chronic gut issues, whether they have their enteric nervous system degenerated or have neurodegenerative disease impacting their gut or have an autoimmune disease, you still have to follow strategies to improve your gut health, just so you maintain your health. So you may need to take ongoing prebiotics, and you may have to take digestive enzymes on an ongoing basis. You may have to take support for leaky gut on an ongoing basis, like things like glutamine, things like short-chain fatty acids, to really help optimize your gut function to stay healthy. So, those unresponsive gastrointestinal mechanisms are really important to understand, so you don't feel frustrated, like, why do I still have gut issues? I'm eating better than everyone else and taking all these supplements. Well, because you have a cause that's doing it, and in order to maintain your health, you have to constantly put an effort into changing your gut inflammation and supporting your gut regeneration and supporting your digestion to function well. So those are the main concepts. I talked a lot, so let me take some questions. And by the way, if you haven't followed us on Facebook, please follow us so you can know when all our talks are happening. And you can also follow us on Instagram. I always been told to mention these things, but I always forget. So.
Well done.
There we go.
Good job. Okay. Ready.
Questions.
So questions.
Yep.
So Michael's asking, does taking gut enzymes make the gut lazy? Meaning, your gut produces less enzymes because you're taking them externally.
No. So let me explain a few things. If you take out enzymes, your gut's not only going to shut off and stop making enzymes. That just doesn't happen. But your gut enzymes and the production of your gut enzyme are going to be influenced by your diet and the things you eat, and it can change. So for an example, if you've been on a low-carb diet for a long period of time and just have avoided rice and grains and fibers and whatever the case may be, right? And let's say you don't have celiac disease, you've just been on a low-carb diet. The first few days you add carbs back in, your gut's going to go, oh my gosh, I need to make more pancreatic enzymes. I'm not used to doing that. So it may take a day or two for it to kick in, and then after that, maybe eating the extra carbs aren't really causing bloating and distension anymore. If you aren't used to eating a lot of fermented food, like kimchi or sauerkraut, and you have a whole bunch all at once, you may get really bloated and distended because your body has to, it's immediately changing your bacterial populations, and your gut has to figure out how to deal with that. And after a day or two doing that, you may be totally fine. So there's going to be some adjustments with your gut as you change your diet for a few days, and there'll be the same thing with enzymes. If you're taking enzymes, your body will be used to using them, but if you stop taking them within a day or two, it'll go back to where it was before. So you don't need to worry about like your feedback loops all of a sudden shutting down to digest your foods. It just does not happen. Okay, next question.
Okay, so Vera is asking, how do you figure out if you have intestinal permeability?
So if you want to know if you have intestinal permeability, we call it leaky gut, there's actually laboratory tests that measure it. And objectively, they look for a marker called zonulin, like zonulin antibody or actomyosin antibody. Like in my practice, we use a lab from Celiac Labs, and I work with Celiac Labs as a consultant, so just disclosure. But Celiac has a very good panel called the Ray2, where they check for zonulin and actomyosin antibodies. And if those are elevated, those are associated with intestinal permeability. Other labs also offer markers like zonulin and as well.
Okay, so Irina is asking, how long do you need to be gluten-free, dairy-free to see a difference?
How long do you need to be gluten-free or dairy-free to see a difference?
She didn't say what kind of difference, but
okay. So I would say, let's just say, if you have sensitivity to gluten and dairy, it's going to take at least a couple weeks to even have a chance to know a difference. Like if you're, and this is assuming you're really strict, like if you're still putting milk in your coffee, you're trying to be dairy-free, you're still like, there's some milk in that, but not much, then you're never going to know if you actually are or not. So one of the benefits of knowing if you are, and by removing foods from your diet, is basically what's called an elimination diet, elimination and provocation. So elimination provocation, first thing is you got to be 100% sure you're completely off gluten and dairy. And it usually takes 2 to 3 weeks to notice the difference. Yes, for some people, it's within 2 days they notice difference. Like a lot of people that are, for example, sensitive to gluten and dairy, they'll go off gluten and dairy and just wake up the second day and go, my brain fog is different. It can't be gluten and dairy. It just must be a good day. And then it happens, and then they keep feeling better, and they keep feeling better, and they're still not really convinced it happens. And then they get an accidental exposure and they feel awful, and then they go, okay, it really is. That really is the scenario. So you got to give a little bit of time, because remember, these are delayed immune responses, and there's a lot of inflammation there. So the biggest mistake people make is they're just not really 100% gluten or dairy free, and they don't have at least that 2 to 3 week window to determine if it's reacting for them, causing a reaction for them. So try to go 2 to 3 weeks 100% free. Usually you'll feel it way before 2 to 3 weeks, even within the first week. But that's a good time window.
Okay, so speaking to that, Debbie's asking, what is the best food sensitivity test, and what do you think about MRT?
Well, the best food sensitivity test is, so that when you look at food sensitivity testing, they're looking at antibodies for the most part. And the gold standard type of technology to check them is what's called ELISA, enzyme-linked immunosorbent assay.
ELISA.
Yeah, ELISA. I think then what I use in my practice is a panel from Celiac Labs called the Ray number 10, and they use ELISA. But even more importantly, they check for foods that are cooked versus raw, and they check for specific proteins of versions of lectins that you need to isolate to identify the food sensitivity, and they check for gums that are found in many foods. So I like to use, I think if you have access to any food sensitivity panel, the best one without question will be Celiac Ray 10. Now what's also out there is some labs that use something called microarray analysis. Microarray analysis, what they do is they don't use ELISA, they use a very small amount of the protein, and then they do an algorithm to calculate if it's actually going to be positive or negative. The problem with that kind of test is that it's not as accurate, and you can have a lot of false positives and false negatives. What's very popular, like, is the Zoomer test, and that is using microarray. So I don't think it's as good as ELISA. I personally always prefer ELISA. Then there's MRT and what are called cell-mediated testing, which are really questionable. They're actually banned in many states. They have issues with reproducibility and their specificity and sensitivity is a major issue. There's been several papers published on them. So they're not going to be published under MRT. They're going to be published under cell-mediated food sensitivity testing. And cell-mediated testing is they're looking to see if the cell swells when they get exposed to the protein. And lots of things can cause the cells to swell unrelated to the food sensitivity response. And there's a lot of error in really determining the cell size changing for that. So I'm not a big fan of MRT because of the type of technology they're using. Now, again, I don't have any preference for one kind of lab or another. It's just, you got to be very, the things we're talking about is technology involved. Cell-mediated versus microarray versus ELISA. If you use any lab, make sure that it's ELISA, ELICA based testing, and the lab is an accredited lab. The thing you're looking for, at least in the US, is a CLIA certified lab.
Okay, perfect. So this is with long.
Oh, by the way, I forgot. we did create a course on food sensitivity solving the puzzle. It's also available at Dr. K News, drknews.com, and then we go in that course and teach you all the different methods of how food sensitivities are tested, the strengths and weaknesses of each of them, and then why people react to foods. There's lots of mechanisms unrelated food sensitivities where people react to foods, and if you're really confused about the science of food sensitivity testing and how things work and how things are analyzed and how to interpret those types of testing, please check out the food sensitivity solving the puzzle at Dr. K News.
Perfect.
Okay.
Okay. So Michael's asking, with long-term fasting.
Yes.
Right,
long-term fasting.
Okay. He didn't say what that
Okay.
actually means to him, right?
Okay,
But
okay.
with long-term fasting, how do you deal with a diabetic patient? They shouldn't miss meals. Do you mean not missing meals within their feeding window, or what does that mean?
So, first of all, I think it's hard to answer this question. It may be hard for people to understand what you're asking because
Right.
the term fasting and long-term fasting can have different opinions for different people.
Right.
So let's define a few terms. Intermittent fasting can be done when you have like alternative day eating, where you just fast for a day, once a week or twice a week. It could be a time-restricted feeding window, where you fast for 14 hours and eat for 10, or fast for 18 hours and eat for 6. So those are more intermittent fasting. So intermittent fasting, these are like alternative day, or even short-term fasting would be like not eating anything for 3 days except like water, maybe having some salt, electrolytes. Those are all under the short-term fasting. Long-term fasting by definition means more than 3 days. Now, some people use the term long-term fasting by meaning they're doing intermittent fasting for a long time, or they're doing alternate day fasting for a long time. So it depends on what you're referring to. Now, as far as diabetics go, depends. If they can regulate their blood sugar, they can determine what their insulin if they're insulin dependent, they can see what their insulin requirements are. If they're eating within a feeding window, that's really the easiest way to do it, because they just can fast for. They start with 14-hour fasting and then go to 16-hour fasting, and then while they're eating, they can work with their medication if they're taking it, but it should be done with the person's physician that's prescribing the medication with another intermittent fasting. Generally, it's no problem at all for people to do intermittent fasting with diabetes, especially if they do the time-restricted fasting. Once you get in trouble is when you start doing long 3-day, 4-day, 5-day fasting, and then if you're taking your medication with that, you can definitely get hypoglycemic, and you should never do any kind of those fasts if you're prescribed any anti-diabetic medication without talking to your doctor. The easiest ones to use would be the time-restricted time-restricted fasting, where you just have a feeding window and a fasting window. If you're on insulin, it's the same thing. You can monitor your insulin levels and see what your doses are. Okay. And by the way, it has a profound impact on changing diabetes in a very positive way. And in some cases, people that start doing intermittent fasting can even reverse their condition because of it.
Okay, perfect.
Yep.
So here's a question I like.
Okay.
Michael's asking, I've heard some people do not have quote unquote bad responses to gluten and pasta in Europe. Why?
Yes. Yes. So there are. So let me explain gluten. God, we should. You know what? We should do a talk just on gluten.
Ugh, already
Okay,
done.
next
Okay.
week. Next week, just to gluten.
Just
There's
on
a lot of
gluten?
variations of
There's
gluten.
a
So
lot.
there's different branches of gluten. There's some proteins. There's
Okay.
different variations. So thank you for the question, because now we have our next week's topic.
Good job, Michael.
But gluten is complex. It's a science, and so gluten has many different branches. There's the gamma gliadin branch, alpha gliadin branch, 17 gluten branch. There's different transglutaminase enzymes that respond to gluten. There's glutenin. There's glutamorphins. So we'll talk about that all next week.
Yeah, don't confuse
I'll break it down. But the key thing that you have to understand is, in the immunology world, they're looking at these different branches. So there's people that are actually studying gluten as their thing. That's their only area they're focused in on. And they're realizing that there's different branches of gluten, and some people react to different branches of gluten. And it's not like, for example, when you get tested in the lab today in the US, they're only checking alpha gliadin, which is the most common form of gluten sensitivity, where one branch of the gluten protein reacts to people that have celiac disease. Now, if you have a gamma gliadin reaction, which is a different branch of the protein, you may never show positive for alpha gliadin or gluten sensitivity testing. You will, if they measured alpha gliadin, which is what all labs measure in the U.S., but you would have to have specifically measured gamma gliadin. Now, there's also something called deaminated gliadin, which is gluten that is processed by your gut to be converted so you can digest it. And when we do food processing processes, there's some manufacturing deamidation that takes place that changes the gluten structure. Some people are very sensitive to processed grains. Now, the thing with Europe is Europe has a couple things. Number one, the proteins they're using in the gluten grains they're using in Europe are not the same grains we're using in the U.S. So they call some of these grains are referred to by some researchers as native grain versus modern grain. So modern grain has hybridization processes where they take grain like gluten. They don't genetically modify it, but they hybridize it. They make these seeds combine with each other so they're more resistant to weather and pesticides. Those hybridized wheat strains are not used as often in Europe. The other key thing is there's some people that are extremely sensitive to glyphosates. Glyphosates being the most common pesticide they use. And the use of glyphosates in the U.S. for wheat crops is extremely high. And they actually use it to kill all the weed before they plant grains, and the soil just really contaminated with it. And one of the theories is that some people that are extremely sensitive to gluten are actually really just glyphosate sensitive. And in Europe, even though glyphosates have not been completely banned, in some countries they're absolutely banned. Like if you go to Japan, they're banned. They can't use them. Some parts of Europe, like France, they still allow glyphosates, but they're just not used very often in large farms. So some people get exposed to native grains with less or no glyphosates, and they don't have any reactions. And that happens all the time. And we hear stories the opposite way. We hear Europeans going, only when I come to the U.S. do I have to be gluten-free because I feel sick. And then we hear from Americans, only when I go to Europe. Now, some people have celiac disease. It doesn't matter. They can't even tolerate the native branch of gluten. So it just depends on the degree of severity and if you actually have glyphosate sensitivity or just the gluten sensitivity.
Right. Okay. So Cindy's asking, are there supplements to help with the vagus nerve?
Are there supplements to help with the vagus nerve? No. There really aren't any supplements to help with the vagus nerve. It's like, are there any supplements to help your muscles grow? Like, well, if you read Muscle and Fitness, it sure looks that way. They'll just put a huge bodybuilder on there with a big protein shake, and so the vagus is a nerve. The nerve is only going to be active. It's only going to grow or regenerate if it gets activation. It needs a proto-oncogene response to have mitochondrial biogenesis and neurogenesis to take place, so it can actually grow and rebranch. The only thing that's going to do that is activating it. Just like if I was wearing a cast and my arm was atrophied, there's no supplement I'm going to be able to take to bring the muscles back that have been atrophied by wearing a cast. I'm gonna actually have to move it. It's the same thing with the vagus nerve. I know people are talking about various essential oils that cause autonomic issues and all that. You guys, it's when you hear that, you go, that's as silly as someone saying they're going to take an essential oil to get larger biceps. That's not how things work. So the only way to really get your vagus to become more active is to be healthier and grow is to activate it. So in the Gut Puzzle program, we talk about gargling, and in my brain book, we talk about gargling and singing and doing different things to activate the vagus nerve itself. Gargling is one easy way to activate the vagus nerve itself.
Okay, I'm combining two of Sean's questions. Okay, if one suffered from severe gut and brain issues for years, but stopped doing gluten,
Yep.
right? And they're likely celiac based on their symptoms, but is now diligently avoiding it. Is there any reason to test for a formal diagnosis?
Well, that's a good question. So let me just recap.
Gut and brain issues.
Gut and brain issues, went off gluten, felt a lot better. Mm-hmm. Should they go and test?
Right, and then should
they test? Yes and no. It depends on what you want to do. So remember, if you haven't been exposed to gluten at all, then you may have a false negative test. Since you're not eating the gluten compound, your body's not going to have an immune response against it. So, if you're not eating it, you just may show up like you don't have it. Not because you don't have reaction to gluten, just because you don't have any proteins to make antibodies, which is measured, right?
That was part of his first question too. Do you need to go back on it to go?
So yeah, technically, I mean, if you've completely been 100% avoiding it, you may not test unless you get exposed. Now, some people think they're 100% gluten-free. They still get accidental exposure when they do their blood test. That shows up like they're getting exposed. They don't even know it, and they can understand the connection. They can't understand from where it's coming from, but that happens very commonly as well. The other key thing is sometimes, we test people that are completely gluten-free, 100% restrictive, not for gluten antibodies. We measure them for a marker called transglutaminase. And we'll talk about this next week. Transglutaminase is a marker that is involved with the autoimmune response. It's a self-tissue marker. It's not related to the gluten itself. It's the enzyme you have in your body. So people that have transglutaminase 2 will have intestinal destruction, 3 will have skin inflammation, and 6 will have brain-related issues. So sometimes we'll see a patient that has massive neurodegeneration at an early age. We're trying to figure out what the mechanism is. And we'll measure transglutaminase 6, especially if they have what's called ataxia, where they get dizzy and vertigo. There's a mechanism called gluten ataxia. And transglutaminase antibodies are very high in them. And even if they're not eating gluten, those antibodies can still be very active with them, which lets us know that there's an autoimmune mechanism that's causing their brain destruction. So in summary, if you haven't had any gluten exposure, it's very possible you can have a false negative test. But even if you have or have not had gluten exposure, you can still measure the self-tissue antibodies to react to gluten called transglutaminase to see if there's a relation to brain or skin or gut mucosa if you want to. Okay. Next week we'll talk more.
Yeah. Okay. Chiara is saying, I thought you recommended huperzine for improved vagal tone, and someone posted a thing about a supplement called Vagus Support Plus, right? So
right,
it's
Vagus Support Plus, right? Okay. So huperzine is a very powerful supplement that is an acetylcholinesterase inhibitor, which is great to activate the acetylcholine pathway. So the vagus nerve fires through the acetylcholine pathway. So you can't take huperzine, but it's not going to make your vagus nerve regenerate. It's just going to help with neurotransmission. Right. So let me explain the key concept. Neurotransmission alone is not going to, if you increase a botanical that increases acetylcholinesterase inhibition, which means this acetylcholine that activates your vagus nerve hangs out longer, which is, most people use it for memory because acetylcholine is also used for memory, doesn't make your nerve grow. What's going to make your nerve grow is if you actually stimulate neurogenesis and mitochondrial biogenesis, which means you have to activate genes that turn on proteins. So huperzine is not going to activate genes to turn on proteins. Huperzine is just going to make acetylcholine function activate. So it will help with the neurotransmission of the vagus, but it's not going to make it grow. It's not going to make it heal, right? And as far as some supplement called Vagus whatever, that's, I don't know. It's hard for me to digest.
Ha ha ha.
Okay.
Sorry, that was pretty funny. Okay, so this is kind of a common question people are asking. I thought my brain symptoms, I thought my brain symptoms and gut issues were due to gluten, but I stopped eating gluten and my symptoms didn't improve.
Right.
That's the deal.
So
A lot of people
it
are
could be more than gluten.
right.
So listen, realistically, it's almost always more than gluten. Gluten has very similar amino acid proteins to milk. So people go gluten free and they're eating milk all day. They're eating like
Right.
dairy all day. Like it doesn't work. You have to almost always go gluten dairy free. And actually, to do it really correctly, you should just go grain and dairy free altogether. So if you're ever going to do a trial, go grain and dairy free altogether. Because if you don't, you're going to miss it. The protein similarities between other grains and gluten and other milk proteins and gluten are very, very common. And even within the celiac disease literature, a lot of people don't recover from their intestinal biopsy abnormal findings like villus atrophy until they go grain and dairy free, especially dairy free. So if you're going to commit, then just go, just think of going like grain and dairy free. That'll be much easier. To be honest, in my practice, I don't do gluten-free diets. I do total grain-free diets and dairy-free diets altogether because of just the same observation you may have had. It just doesn't work. You just need to go gluten, dairy, and grain-free, not just gluten-free alone, to determine your sensitivity to it.
Okay, question from Emily. Hi, Emily. If all regular tests for inflammation, celiac disease, etc., from my primary care doctor came back normal, we don't know what the tests are, but that's
Okay.
right. And I know in my gut, haha, pun intended, haha, and in my brain something is wrong. What do I do?
You're not alone. I
Yeah.
mean, a lot of people like have had normal tests and they know there's something wrong with their brain. They don't know what's happening. I wish I had a good answer for you.
And she has the gut program.
And she has the gut program.
Yeah.
Well, I mean, the problem is, we have a healthcare system that includes both conventional alternative that's not trained and focused on looking for improving brain function and trying to find early neurodegeneration. So, I mean, if you walk into your average conventional or alternative clinic, they just don't really focus on that. You have to wait for someone to get Alzheimer's disease and to get to the point where their daily activities are compromised before they get the diagnosis. You have many people that just have severe mechanisms that cause neuroinflammation and brain issues that cause problems. So I don't know what the answer to your specific condition is. I can just tell you not alone. It's the majority. There's a majority of people that have brain-related issues that are completely getting ignored, and they don't have a very clear underlying disease that's causing it. It's part of the reason I wrote my book, Why Isn't My Brain Working? To try to help people identify some of those symptoms. A lot of times, that's a combination of things. It may not be gluten. It just may be because you have blood sugar issues you're totally ignoring. Or you may have some other sources of neuroinflammation besides gluten that's causing them. We also have an online program called Save Your Brain at drknews, drknews.com. And that we walk through people like the most common things that really tend to promote neurodegeneration and lifestyle factors and diet things you can do to kind of work through the process. You may want to check that course out. But fixing your gut and optimizing your gut is certainly one step in the right direction of improving your brain function. So, it's not uncommon for people that have neurodegenerative mechanisms, their brain's not working, to basically have to work through the process of just finding more than one thing. If you get your gut out of the way and that gut, there are no more gastrointestinal symptoms, you still have brain issues, then there could be other factors that are there. Most common one, by the way, is just like blood sugar instability. So that's something to really think about. But again, check out the Save Your Brain program or check out my book, Why Is My Brain Working? And the Why Isn't Your Brain Working, I start each chapter out with a series of symptoms and then applications to it. So you may want to look at that as well.
Okay, perfect. Any other labs other than Genova to test stool? You talked about Genova for stool testing.
There's lots of great labs out there that do stool analysis testing. Once again, just make sure that they are CLIA certified, CLIA certified. So that's all I can say. I can't name every lab yet.
Sure. Okay. Deborah's asking, is pernicious anemia reversible or can it be put into remission?
Okay, so pernicious anemia. First of all, you got to make sure it's diagnosed properly.
Right.
Because a lot of people use the term pernicious anemia just because someone has what's called macrocytic anemia or so-called B12 anemia. The true diagnostic definition of pernicious anemia is a person has antibodies to intrinsic factor. So they do a blood test and they have intrinsic factor blocking antibodies, which means their immune system is attacking the carrier protein of B12. So when people have actual pernicious anemia, they have this antibody measurable in their blood test, and the reason they become B12 anemic isn't because they're not eating it, it's because their immune system is destroying the protein that carries it across, and in those cases, they need B12 shots. So the question is, can you reverse it?
Right.
Well,
can you reverse it, or can it be put in remission?
So any autoimmune disease has potential to be put in remission,
Right.
But you definitely want to keep an eye on your B12 and anemia levels. So ideally, initially you're gonna, if you actually have pernicious anemia, B12 shots are the way that it's treated, because when you get the injections, you bypass the absorption to the gut. It gets right into your bloodstream, and your red blood cells can get the nutrient it needs to go to a normal size, so they can carry oxygen more efficiently. And then at that point, basically, for some people, if they can really control their autoimmune and go into remission, they just don't have as much of that expression of their antibodies against this carrier protein, and sometimes they can tolerate just taking a B12 supplement, and they never develop anemia again. The marker you definitely want to keep an eye on is a marker called methylmalonic acid, and all conventional labs do methylmalonic acid. It could be done in urine, it could be done in blood. That's your best marker to determine if you actually have B12 deficiency. So once you get it managed with B12 shots, keep your eye on methylmalonic acid, and as if you're doing strategies to improve your diet and lifestyle to potentially go into remission, you also want to make sure your methylmalonic acid levels are within normal range. Some people can get away with not having to do shots regularly, some people cannot. So you just have to look at your lab markers and see what they're showing.
Methylmalonic acid.
Yes.
Okay, so quite a few people are saying, okay, we're taking the gut puzzle.
Oh, thank you for taking the gut puzzle.
Yeah, that was not it though. They're taking the gut puzzle.
I hope you guys are enjoying it. I just, we only hear criticism.
But no. People are really enjoying it. They're happy to do it. They're in it, and they're like asking, right? So it's great.
Sure.
But they're taking the gut puzzle, but it doesn't seem to address if you do not have a gallbladder.
Oh,
what do they do?
Sorry. Okay. If you don't have a gallbladder, just assume you have a gallbladder.
Explain that.
So a gallbladder is basically a sac that contracts, right? So when the gallbladder gets taken out, think of it, there's the gallbladder and there's a duct, right? When the gallbladder gets taken out, this duct pooches out to a new gallbladder,
which is called
the cystic duct. Right? And there's people that have post-cholecystectomy syndrome, which is a name for it, where the gallbladder pooches out and they still have ongoing gallbladder symptoms. So gallbladder being taken out just means, like, for some people, the reason the gallbladder gets taken out is because they're having severe symptoms because the gallbladder is spasming all the time, and they have thick bile in there, and that's constant spasms, and even a gallstone obstruction causes significant pain into their back, into their shoulder blade. They can get symptoms of fever. They just feel terrible, right? So because of a gallstone obstruction, or severe gallbladder spasm, they take their gallbladder out, and then there isn't all this pressure against the gallbladder. But then they still have intolerance to digesting foods, because they, ultimately to digest foods, you need bile. So the cystic duct pushes out to a gallbladder, and that can also start to spasm. It's not as likely, so that's why the main symptoms go away. But people still have persistent intolerance to fat and bloating and digestion, because they still have thick bile. And in the gut puzzle program, we do go into great detail of how to thin out your bile. And if you've had your gallbladder removed and you still have gallbladder symptoms, just follow all the protocols in the gut puzzle program as if you still had your gallbladder, because you still have bile synthesis through your liver, and it still gets stored in your cystic duct after the gallbladder is removed.
Yes. Okay. Sharon's asking,
okay,
what do you think of the rotation diet, where you eat different foods every day for 4 to 7 days? You may not know what that diet is, but what do you think about diets like that?
Yeah, rotation diets have a place, for sure.
Make sure the foods you're not sensitive to.
The rotation diets, when you have a chronic inflammatory issue, autoimmune issue, or gut issue, they're not as effective, because so many foods still cause systemic inflammation. You can never really get rid of the inflammation to make a big difference. Generally, in a real-world setting, ideal health is by a rotation diet, having a lot of different diversity of plant proteins and proteins. So it depends on the context. I think you're relatively healthy. Rotation diet is something you can do. If you have something like an autoimmune disease or severe intestinal inflammation or leaky gut, you're just going to have to go on a strict restriction diet and allow your gut to heal. And then if you have the ability to get some degree of health, then you can do something like a rotation diet.
Okay.
Rotation diet, they just have different food groups come in at different times, and to help with their immune function recovery and diagnostic testing to responses to foods.
Okay. So many people are saying thank you so much for these talks. They
Oh,
really
thank
are.
you.
It's
What a
really
pleasure.
nice to.
Thank you.
It's really nice for people to say that. Thank you, everybody. That's super nice. Okay. All right. Here's Laura.
Okay.
Is there a test for Parkinson's disease when it is only affecting the gut, but you do not have tremors yet? So like early testing.
Oh, like an early day. So
right.
there are testings there are scans where they do different dyes that get picked up by X-rays to look for alpha-synuclein. They're in research settings right now. They're not commercially available. That's one of the main problems.
What are they scanning?
But listen, if it's showing up in your gut, there's still going to be some alpha-synuclein in the brain. It just hasn't progressed enough to cause brain symptoms. So they're going to do a brain scan with dyes, and they'll find early Parkinson's disease alpha-synuclein patterns with them. There's some indications that alpha-synuclein antibodies blood test may have some correlation with early Parkinson's that hasn't fully expressed yet. That isn't causative and clear research. It just shows that there tends to be a higher amount of alpha-synuclein antibodies with the blood test to do it. To be quite honest, ultimately there isn't really a good test that gives you the definite diagnosis.
In the gut.
And if the Parkinsonian is starting in the gut, that's why it's so difficult. So the key thing is to look for those initial clinical symptoms and keep an eye on Parkinson's disease. With most neurodegenerative diseases, you really can't clearly diagnose them until they get really progressed, where it becomes obvious, like with Parkinson's, tremor, Alzheimer's disease, not being able to take care of yourself, chronic traumatic encephalopathy, when they get head injuries and they have psychiatric problems. They can't even diagnose them until they do an autopsy. Mm-hmm. So with a lot of neurodegenerative diseases, unless you get to end stage or you get a brain biopsy post-mortem when you're dead, they really can't make the clear diagnosis, and that's the difficulty we have. So that's the way it is. Okay, that's it. Last questions?
I can do a last question.
Yeah, last question.
Okay, someone's at Dondi is asking, what about nightshades and leaky gut?
Yeah, so nightshades are a problem for many, many people, especially those with autoimmune disease, and especially those that have rheumatoid arthritis and joint arthritides. They really have a hard time with nightshades. So nightshades are, for example, foods like eggplant, tomato. Those are the most common consumed nightshades. And they contain alkaloids. So there's a couple things you should know about nightshades. And we talked about this in the food sensitivity solving the puzzle program. Some people react to nightshades because they have an antibody reaction against them, but some people don't have antibody reaction against nightshades. They have an alkaloid reaction to them, and they don't show up on an antibody blood test. The only way they know they're reactive is to stop eating nightshades. So avoiding peppers and tomatoes and eggplants and potatoes, or things they just have to do for, let's say, 2 to 3 weeks to see if they get better. But anyone with rheumatoid arthritis, and the reason there's some associations between the genes involved with RA and the sensitivity to nightshades. It's very common in regions of Greece, Italy, where there's a lot of RA and nightshade sensitivity. So if you have some ethnic roots to those regions, then you'd be more likely to have that sensitivity. But nightshades are a very, very real thing, and they're not always going to show up on a food antibody sensitivity panel. It's not always immune based. Sometimes it's just alkaloid based. So sometimes you have to do a trial and error.
I have two more things to say. Sorry.
Yeah,
can you please ask Elaine or Susan to put up a link to the gut puzzle because people are asking, and can you just tell people also where?
Yes.
People are saying that. What's this gut puzzle? What is this?
This gut puzzle. We'll put a link up. But if you go to drknews.com, there's a link to go to the gut puzzle program. We'll put a link up in a second here, and check it out. We put a lot of work into it. So it has diets and videos and stuff there. That's there. Anyways, thank you all for joining me today, and I hope some information was useful for you. And thank you so much.
Thank you everyone for the nice comments.
Thank you everyone.
Thank you. It was really nice.
Taking the puzzle program too.
Thank you.
Thank you.